Can we just make sure, because we're live now in the formal part of the meeting, if you've got your mobile phones on silent. And I'm going to ask you all to introduce yourselves. We'll start with the front row and work backwards.
Hi, I'm Matt England, Associate Director of Planning and Partnerships for Mid Yorkshire Teaching Trust. I'm here deputising for Len Richards.
Hi, I'm Carol McKenna and I'm the place lead for Kirklees within the West Yorkshire ICB.
Hi, I'm Emily Parry-Harris. I'm Consultant in Public Health for Kirklees.
Hi, I'm Liz Mear. I'm the Chair for the Kirklees Place within West Yorkshire ICB.
Hi, I'm Warren Gillibrand. I'm the Head of Nursing at University of Huddersfield.
Hi, Carmen Gibson, Homes Director of Services for Children, Young People and Families in Swift, deputising for Sean Rayner.
Good afternoon, Victoria Valens. I'm Deputy Chief Executive and Exec Director for Services and Professionals with Locala, and I'm here representing Karen Jackson.
Hello, I'm Carol. I'm Councillor Carol Patterson, leader of Kirklees Council.
And on the back row.
Hi, my name's Rachel Spencer-Henschel. I'm the Director of Public Health for Kirklees.
Hi, I'm Christine Fox, Director of Customer and Community Services at Connect Housing and Link with West Yorkshire Housing Partnership.
Hi, I'm Alistair Brown, Chief Executive with Kirklees Active Leisure and here representing third sector leaders.
Hi, I'm Lisa Williams, Deputy Director of Transformation and Partnerships at CHFT, and I'm here for Catherine Riley.
Hi, Stacey Appleyard, Director of Health Watch Kirklees.
And online we have James, you want to introduce?
Hi, James Cregan. I'm Chief Executive Officer of Kirklees Care Association, representing independent, private and VCSE social care providers.
Hi, I'm Cass Sims, Service Director for Adult Social Care Operations at Kirklees Council. I'm representing Richard Parry today and presenting later on as well.
I'm Adrian Vishnevsky and I'm supporting Joe on the SEND programme.
Good afternoon, I'm Joanne Sanders. I'm Service Director for Learning and Early Support at Kirklees Council, here to present about SEND.
And we've got Liz, who's here as a member of the public now, who's just been presenting to the informal section. So I'll let you introduce yourself so people know who's in the room.
Okay. I'm Liz Towns-Andrews from the University of Huddersfield, and I'm the Regional and the Business Lead for the National Health Innovation Campus, but I'm just observing this session.
Are there any apologies for absence?
Yes, Chair, we've received apologies from Catherine Riley, Vanessa Taylor, Richard Parry, Karen Jackson, Sean Rayner, Dale Gardner and Tom Brailsford.
Does anyone else have any apologies in the room?
There's Len Richards from Mid Yorkshire Hospitals Trust.
Now we've got to approve the minutes of the last meeting, and as the new chair I wasn't there, so can somebody from the floor move that they're approved, or if there are any corrections? Carol, and seconded? Does anybody have any interest to declare? Nobody? All these agenda items today will be considered in public, and the public are welcome to the Health and Wellbeing Board. Do we have any deputations from the public?
None received, Chair.
And are there any public questions?
Again, none received, Chair.
Right, the first item of business that we have today will be to appoint a new deputy chair, and I would like to propose Dr. Warren Gillibrand. Have anybody to second that nomination? And if you're speaking, please remember to use your microphone because we can't hear you.
Seconded.
So our first item we have with the presentation is about the SEND transformation update. And can I introduce Joanne Sanders and Adrian?
That's a good effort, that's fine.
Thank you.
Good afternoon. Thank you very much. So, as I introduce myself, Joanne Sanders, I'm the Senior Responsible Officer for our SEND transformation programme across the local area. And we came to Health and Wellbeing Board probably around February with some updates about where we were, the progress that we've made. And because the Health and Wellbeing Board is at the most senior part of governance for this programme, we were keen to bring you some updates on things that have happened and next steps. So if we just move on, Ed, just in terms of what do we just want to update you on, some of the things that we've been doing in terms of shifting culture, some of our focuses, but the challenges as well, some key milestones that we've achieved, how the impact that we're making, all this effort that us as a local area partnership, but so what's been the impact, what we're on with next, and then to ask for yourselves whether there's any areas by which you'd like us to present next on a deep dive. So, we'll start with, we've been trying to shift the culture, so we've talked very much about having, this is a system approach to make things better for children and families, and those children as they prepare to become adults. And I think there's been some opportunities that we've recognised, which is not all about whether it's the council or the ICB or social care. It's about how we work together in partnership with our families, with anybody who wants to help and support us, and to drive some of that shared accountability. So certainly, these are some of the cogs that have to work together. So co-production is something that we feel really proud of in our local area. We have a very active parent carer forum that hold us to account, challenge us, but are also incredibly supportive. Clear governance at all. We have 3 levels of governance, making sure that we've got the right buy-in at each level. So the highest strategic influence, our partners, but also then that operational level as well, the people who will do some of the doing. We've had a clear focus on not just making sure we're doing things within a timely way, but making sure they're of quality. It's making sure that we do things so that they're set up to have impact. And making sure that rather than just being, I suppose, behind a computer screen or behind a desk, actually we're stepping out and listening to people's lived experience, trying to make a big difference on the ground. No better example than the Local Offer Live event that was supported by a range of partners, but was led by our Parent Carer Forum that happened in June, and the feedback was exceptional. We'll share a little bit of that in due course. I think some of this as well is about being brave, doing the same thing and expecting a different outcome. I think somebody said once that that's the definition of madness. But we are trying to look at innovation. So rather than just looking inwards at Kirklees, we're looking up and down the country and seeking out opportunities. No better example of that is the new way of working that we're just embarking on with our mainstream schools, of which there are about 170, and have just begun to start working in groups that we've called clusters. It really is about us, so us working with schools, wrapping a team around those schools so that we can identify needs early and meet them as soon as possible. And then there are some of those more system changes, the investment that the local area is making into rebuilding 2 of our special schools, making sure there are enough places to cater for needs locally. Looking at additional resource provisions, looking at special school satellites so we can bring some of that great practice into mainstream as well. And crucially, we were successful in securing government support for an alternative provision-free school. So all of those things need to work together to make sure we're able to achieve better outcomes for our youngsters. So, just in terms of where's our focus been, but what have the challenges been? So, I think when we came last time, we shared with you the big plan. We have had from yourselves, but also across the area and beyond, some really positive feedback about the way in which that was very accessible. The language was easy to understand, and it's really helped us to prioritise and focus in a sequenced approach, what we do next, and making sure we're evolving that rather than revolution, i.e. we don't want to just change everything all at once because that becomes confusing for the system. But there is a challenge in all of that. Demand is not staying static. We're seeing demand increase. The complexities of some of our youngsters and families increase. We are all operating within a very challenging financial landscape. We know, as I think we mentioned last time, we have a deficit on our high needs block that we are working with the government to resolve. And there is, of course, resource capacity challenges across the system, whether that's things that's nationally recognised, it's not just bespoke to Kirklees, things like educational psychologists or speech and language therapists. But actually, we can only weather this storm and drive forward that change if we do that together. Move on. So, what have we done? We came last time in February. Just in terms of what have we achieved? So, as a local area, we were inspected and we had a written statement of action. We've been having several monitoring visits by the DFE and NHS England, and we had a very, very positive meeting with a lot of our actions, the progress, whether that's qualitative as well as quantitative, people's lived experience being improved, acknowledged by our colleagues at the DFE. So that was incredible. That was a reflection of all the hard work of the partnership. In March, I touched on the safety valve. We'd had lots of engagement again with the Department for Education, and they acknowledged the challenges in being able to deliver a balanced budget, and we were able to renegotiate the terms of the safety valve, and that was agreed back in March. That gave us a little bit more time to be able to achieve and remove that high needs deficit. Back in April, with the cluster working, we established, we concluded actually our task and finish work. So we were co-producing that new approach with schools, with Parent Carer Forum, with partners, and we had a Pathfinder group of schools come together and start trialling that for us to make sure we got it right. And Kirklees Council Cabinet received a report in June about the clusters and were supportive of us moving forward with that, and that's what we're living now in terms of putting those arrangements in place. In the earliest of years, there were opportunities to support youngsters' inclusion, so we refreshed and made sure our inclusion fund policy was up to date and reflected the changes to early education and that new entitlement. And we asked schools for further expressions of interest to roll out our next phase of additional resource provisions. And we're just about the end of September, but those clusters have gone live. The Early Years Transition Fund, that new approach is live. We have online from September another additional resource provision with more in the pipeline. And very successfully, again, led by our designated clinical officer, our Parent Carer Forum, the Partnership for Inclusion of Neurodiversity, known as PINS, has gone from bidding to actually delivery for 14 primary schools. So a huge amount, that belies the amount of work, energy and effort that the partnership has undertaken. And I'm not going to read out all of those, but just there's that blend there between some statistical information. I'd draw your attention to some of the statistics around the Healthy Child Programme. It's really impressive in terms of the improvements made in performance. Education and healthcare plan compliance is improving. We do have month-on-month improvement, with July and August being a record month in terms of around 200 plans in each month being issued. We're not yet where we want to be, but we are moving in the right direction. So there's just some examples of progress. So what? So is all of this making a difference? Some, don't take my word for it. Just in terms of one of the things that we are trying to do regularly and systemically is capturing people's lived experience. And I just leave those up there for you to read through. But whether it's sort of the experience of the work of health visitors, the experience of attending the local offer live, our project search cohorts and their impact, just that testament from a parent, it could make you quite emotional. And certainly, children's mental health and well-being, the keep in mind approach has really seen a shift in the way in which we work. And that's not one party, it's not one agency, it's about us working together. So some of the work we're doing, we can clearly articulate the impact it's having. Next slide. So, what's next? Just in terms of what we have planned, you can see there, we are really fortunate that we've had the opportunity to start a conversation with RISE Partnership, and RISE stands for Research and Improvement for SEND Excellence, and that's the Council for Disabled Children and National Development Team for Inclusion. We have got some opportunity to work with them to reset and focus on our preparation for adulthood part of the transformation. We met with them just last week to scope out what that support could look like, so we're really excited about that. The clusters, workforce development, we're looking at a review of our special school funding to ensure that we can equip them with all the tools they need to be able to meet the needs of our youngsters. Quality assurance framework and being able to connect with our colleagues in the third sector and Kirklees Care Association. We've started some of those conversations, more to come in that respect. So that's a bit of a whistle-stop tour. I appreciate there's an awful lot of information. There's a lot in that programme of work, and there's an offer really. Next time, if you'd like us to come back, maybe there's something that the board would like to see in a little bit more depth, and we'd be happy to arrange that. So thank you.
Thank you, Joanne. That's great. It's good to see you moving forward in a timely fashion with those key milestones. A lot going on. Really pleased to see the neurodiversity additions and some good partnership work. We've been talking a lot about that today, and some more coming. So from the members, are there any areas you'd like to hear a bit more now? If Joanne can help us, is there anywhere you'd like her to go into more detail and come back and present to us again?
Thanks. Oh, Joanne, sorry, was it me you were looking at? I didn't know. It was someone else. This connects really well to a conversation we had in the last ICB Place Committee when we focused on the Starting Well programme. And I mean, there was a few of us here today that were in that conversation. And we did have quite a long discussion at that time about neurodiversity, in particular waiting times for assessment. And one of the things that came out of that conversation was we didn't all understand the extent to which having a diagnosis unlocked access to other services and support. And that's just because, the different levels of understanding there. And just really to get your thoughts on that, really, and when people are waiting for an assessment, how can we make sure their children have access to the right level of support, even though they haven't got formal diagnosis, because it does still feel that something that comes up quite frequently as a question.
Thank you, Carol. I think it's a really, really good point. I think part of the PINS opportunity, it's 14 primary schools that we're working intensely with. I say we, the DCO, PCAN, and a range of support that we already have in place. Part of the working is with schools in clusters, and it's not all about schools, but actually we've been trying to sort of change the culture in the system. Very much everything's loaded towards getting an education, health and care plan, which is incredibly important. We don't want anybody not to have what they're entitled to. But you get the plan, it shouldn't unlock a load of services. We should be able to wrap around support at the earliest opportunity. Develop the workforce, people's understanding of how best to support in a classroom environment, some of the needs of those youngsters, and having parental confidence. And that's why it's incredibly powerful that the Parent Carer Forum are wrapping some of the training around the PINS programme. Excuse me. We talk about waiting well, that join up with starting well, etc. What we do have alongside statutory services, we do have outreach support as a system. We've agreed to invest in outreach support, so we have specialist outreach teachers. And part of the clusters, we're wrapping that specialist outreach in our educational psychology team as part of the team around the clusters. And sometimes it is about peer-to-peer support, sharing expertise in the system. If the diagnosis comes, we should already be helping to meet those needs. The diagnosis might help other things, but actually we're trying to get early support as soon as is practicable, and in some instances signpost to the right support. So we've really valued, I think we've really valued that opportunity that the PINS programme has brought us. So it's one to watch. Thank you.
Rachel.
Thanks, Joe. Thanks, Adrian. I know it's a really, really big challenge, is this, and it's not just anything one organisation can fix. I think what would be really valuable for me anyway, from a board perspective, is to really get a little bit more in the way of data, because I think that it's really important that we all understand where the demand is coming from. I think there's also something about how we can look at the inequalities in that. Because, we discussed, as Carol said at the last committee, about how, people often go for private diagnoses, and that it risks creating inequality in terms of the ability for people to get the diagnosis and therefore the support that they need. So I think it'd be really helpful for the board to understand the trends we've been seeing in relation to data and demand. I think the other thing for me as well is the cluster thing is such an innovative way of looking at it, because it's saying, rather than a statement leads to a special package of care, how do we ensure, which is right, absolutely, but how do we ensure that the school works together to say, well, if we've got these children and we know they need a particular thing, how do we share resource across that cluster so that we're making best use of the resources available? Because otherwise you end up with schools competing for precious resources when we know there isn't enough to go around. So I think as that builds in, I appreciate it's only just launched in September, I think it'd be really good to see how that's impacted over the first term, appreciating that these things will take some time. Thank you.
Thank you, Rachel. Would you like to come back on that, Joanne?
Just briefly, thank you, Rachel. We've got some of that data, so we can present some data to the board, and I think if we do that, we won't wait for the next meeting, we'll provide that, and then that'll help some further maybe deep dives. The clusters, you're right, we need to give it a fair chance, but we have built in a review point, 2 review points, one just before February half term. wholesale review to make sure it's going as we hope, just before spring bank. So we will absolutely be able to bring some more detail back in due course. So thank you.
Yeah, if you share that with me, John, that'd be great. And we'll be looking at the next meeting about our work plan, so maybe we'll be able to put you in an appropriate place for that. Liz?
Thank you both for a really great presentation. And it came to life for me at when you sent it out before, the impact examples at the end of the presentation. So there's some for individual children, how they've been supported, but then there was the example at the My Happy Mind programme being rolled out to nearly 35,000 pupils, and that sounded like a really great intervention for supporting pupils and young people with their mental health for future as well as now. And I just wondered if that is an ongoing rollout, we will be seeing that continuing rolling out across our schools, because it sounds like a great way to start people thinking about that at an early stage of life. And I suppose coming back to Rachel's point as well, over time, the impact of that and how do we monitor that?
Thank you. So the My Happy Mind, I think there has been, there is some current conversations about how we continue that. It might be helpful at a future point. Our voice team have done some work with young people about the things that make the biggest difference. I know some of that's been able to be shared with ICB colleagues as well as council colleagues. I think it's incredibly powerful about what does make a difference for young people at the earliest possible opportunity. So I think it is valued, so we have to look at ways in which we can sustain it, because it helps getting in there early. Yeah, and the clusters, they're a huge opportunity for us to do different. And it's not, we were talking to cluster leads, it's not about you schools doing things and us doing things, it's how we can do that together. So, yeah, thank you.
Another way of working together, showing that you can do more when you work together. I'm interested in the very early impact of intervention, of getting that information. I've been hearing how the work has been done to push forward on those very, very early visits, like through Kirklees, through the council. And I'm also interested in the ECHP compliance. So how we get into people and get that information to them, to us, and do it quicker, sooner. But first I'm going to bring Stacey in.
Hey, thank you. Just 3 points from me, if that's okay. You mentioned the Parent and Carer Forum. Obviously, as Health Watch, we get to hear from lots of parents and carers, and particularly around what was brought up around the ICB board. It's typically around ADHD and autism diagnoses and assessment waiting times. How can we connect people in with you who are having difficulties? That's my first point, just to clear that up a little bit. And my second point is, we also hear from a Health Watch perspective from people who've had to remove their children from school because they can't, mainstream school can't meet their needs. But also the support takes an exceptionally long time to put in place, so actually having children at home is easier. So how are we supporting those families? And thirdly, this is incredibly difficult for anybody to understand the amount of improvements and challenges and the pathways and everything that's involved in this. How are we explaining this to local families? Because sometimes this is a full-time job for people to keep up with some of the improvements and the different things that are happening. So, yeah, there's just a couple of points for me. Thank you.
Can you answer those, Joanne, please?
I'll try my best. So just in terms of how can parents connect, it's not all about online, but we talk about the local offer. So it's mandatory to have a local offer. I think we've got a very, very good local offer. So it's a website. And look, parents don't have to be part of a parent carer forum. Just recently, some parents have reached out to us saying, you know, they can suggest how things could be different or better. In fact, I met several parents at the local offer live who said, I'd really like to come and talk to you. There's a contact details. They can let us know through the local offer. We've tried to make lots and lots of easy to read and understand information available via there. We also accept not everybody wants an online offer. We do have an SEND newsletter as well, where we try and keep it people up to date with developments, but also it's an interesting part of the PINS, the Neurodiversity Project. Our Parent Carer Forum do some training as well about a day in the life, what it's like to be a parent of a child with additional needs. Because I think it's really eye-opening when you think about you're maybe balancing medical appointments and sometimes just, supporting your child to leave the home, and if you've got more than one child, all of those things. And it's incredibly powerful. I know I've seen and participated in that. So it is incredibly difficult. I think we'll know we've cracked it when parents tell us it's no longer a fight to receive what they need. Just in terms of then, you asked about, I suppose, we do monitor and we do look carefully about children where school is not quite, it doesn't quite fit for them. We are linking with Bernardo's. They have some ADHD navigators. We see that there's a greater prevalence. We're getting better at understanding the needs of our cohorts. That's the other thing that we'll get from the clusters, understanding what the needs are and how best we meet them. So I talked about the alternative provision free school, and we have commissioned some alternative provision. We've got to make sure the provision fits the youngster, and that has to be quite bespoke at times. And parents do vote with their feet, so we see some youngsters becoming electively home educated, not because they don't want to attend school, but actually because it doesn't quite work for them in the current form. So the better practice we have, whether it's mainstream, special school, additional resource provision, then the better able we are to be a bit more flexible in terms of meeting the needs of youngsters. And yeah, just in terms of, we are trying things like the clusters. We have put information, we try and do videos. We're always open to any suggestions about how we can get to more people, but, we'd encourage parents to get in touch with us and tell us the things we can do better, but also the things that we're doing well, because some things are pretty good as well. So I think I've answered your questions. Thanks.
That's great, Joanne. Has anyone got any further questions? So you're going to come back to us. Come back to me with some information, and we're going to look at where we can put it into the future work plan when you've had a chance for the clusters to work. Now, if we can incorporate into that some of those elements that we've had questions about, because to see the clusters is probably working quite well to improve things generally, that'd be great. Thank you very much for very comprehensive replies. So we'll move on now to the next item. We have the Kirklees Better Care Fund. And presenting the item will be Kath Sims and Vicky Dutchburn.
Thank you, Chair. I'll just join the meeting because we did submit a report, but we've done some slides just with the highlights. So I will join online. And share the slides. Okay, so I'm going to start us off, and then Vicky's going to take us through some elements as well. Like I said, there is a report in the pack that you've received, so these are just the highlights from that. We're really here today just to explain to you how we planned for the spending through BCF 24-25, so this financial year, and what we're doing for next year as well, and to get agreement from board. An overview of Better Care Fund, as you know, it's a mechanism really for joint spending between the ICB, so health, and the council as well. It's not new money, so it's important to say that. People often talk about, can we use the BCF for this, that or the other, but it isn't new money, it is funding direct from the council and from the ICB. The only exception to that is that we did get some additional 3-year non-recurrent funding, specifically for adult social care discharge, so supporting hospitals around discharge. That 3-year funding final year is this year. We've not been told yet whether we will get that again, although we suspect that there will be some additional monies coming through for that. There's some very clear national conditions and requirements that we have to follow to spend this money. Essentially, it's around enabling people to stay well, safe and independent at home for longer and providing the right care in the right place at the right time. There's a very clear planning framework that we need to follow. The recent one was a 2-year planning framework, so the BCF plan covered from last year, 23-24, through to this year, 24-25. And there was one narrative to go with that 2 years. That was positive really because often we get short-term monies and you've got to think about what you want to spend it on. Actually having the 2 years has enabled us to plan a little bit easier there. There was some additional amendment to that in the beginning of 24, but that was just around demand and capacity planning. Just a bit of a summary of how we all contribute, or how both partners contribute to this pooled funding. So these are minimum levels of funding that we have to put forward. A bit of a typo there, we've put finding, it's funding at the top. So the NHS contribution was just over £37.5 million for this year. That discharge funding, which I said was the additional, some of that goes direct to the ICB, some of it goes direct to the council, and there's our contributions there. Improved BCF, or otherwise known as IBCF, is the council contribution to the Better Care Fund, so nearly 18 million this year. And then the Disabled Facilities Grant also goes into the BCF as well, which is almost £4 million for this year. In addition to that, I would say that, the ICB and Kirklees Council, contribute to some of the same schemes that the BCF pays for with additional monies as well, but they are the minimum requirements that we're required to put forward. In terms of how we planned the spending for this year, we brought together a working group with representation from both the ICB and Kirklees Council. And because it was a 2-year plan, we wanted to just review how last year's spending had gone. So we reviewed against the criteria. Were we delivering against those national objectives? Were there any risks that were emerging around future delivery? It was a 2-year plan. Was there anything coming up that meant that we would have to just slightly change how we were spending that money? Were we getting value for money through our plans? And then were there any opportunities for efficiency as well through transformation? In terms of the approvals process, the Health and Wellbeing Board is required to complete a planning template. Vicky and I were given delegated responsibility this year to submit on behalf of the Health and Wellbeing Board. We've also delivered updates to the joint Kirklees senior leadership team. We submitted the plans. They were approved by the National BCF team in August, and we are updating our Section 75 agreement. So that's just the legal agreement to say how we're going to spend this money. There is often a bit of back and forth with the national BCF team about whether our narrative and how we're saying we're going to spend the money is explained to them. So it's a bit of back and forth. That's what the delay was there, but they signed that off for us in August, which was really positive. Just an apology from me that we have included the full plan in Appendix 1, but have not attached Appendix 1, unfortunately. So we will send that out after this meeting so that you can see the full plan, including the full narrative. But really, in terms of those key points, we absolutely have to make sure that our plan meets those financial minimum contributions that I've just described, that it's aligned with our assumptions and compliant with those national conditions. So you'll see when you get the full plan, and I'm going to take you through a little bit of now the highlights that we've been able to do that. One of the things that we want to do is improve on our sort of performance for 23-24, which is why we've done that planning around what worked well, what maybe didn't, what we want to do more of, and what we want to do less of. So a bit of a summary really of the spend by scheme. So we've got 7 key schemes that we work towards on our BCF spend. The first one is aids to daily living. So as you can imagine, that's around equipment. through our contract and work with Kirklees. It's also supporting assistive technology, and that's where we report through our use of the Disabled Facilities Grant as well. So that's sort of minor and major adaptations in people's own homes, things like stair lifts, single access showers, etc. So that's around aiding daily living. The next one, and we'll talk a little bit more about this, or Vicky will when we get to the outcomes, is transforming our intermediate care and reablement offer. So that's that home-based intermediate care, as well as bed-based intermediate care. So people will be aware of, we've got Ingsway, we've got Moorlands Grange, which really support on that intermediate care offer for people who can't leave hospital and go straight home, who require some additional therapy needs in a bedded facility first. Support to unpaid carers, we're contributing, or we've put 2.4 million towards how we support our unpaid carers across Kirklees, through particularly the Carers Trust and Carers Count, which are two organisations. A big proportion of the funds, as you can see, goes towards supporting the social care offer. If you remember earlier in the presentation, just mentioned supporting people to live independently at home, and a lot of that is around actually how we support people to access the right domiciliary care, but also receive direct payments, which is a way that people can receive money to meet their needs and spend it in the way of their choosing. So we're putting quite a lot of money towards the provision of direct payments and home care for people to live independently at home. We also support the voluntary and community sector, breakdown of the money there, which is around specifically social prescribing. Some additional care home support, and James, I know, is on the call there, which is our support to residential and nursing homes through the independent sector. And then a significant proportion towards our Home First model, so supporting people to be discharged from hospital. So that's pretty much the breakdown at high level of how we've spent the scheme this year. And like I say, in the more detailed pack, you'll see that in more detail. What we learnt from when we did the planning for 24-25 was that some of the timings didn't align very well. So the budget planning cycle started before the NHS planning cycle for budget, which started at a different time to the BCF planning cycle. So it didn't quite align. So me and Vicky have set up a kind of a new process to say we really want to start this planning cycle earlier for next year. And we want to get our indicative plans together by mid-October, so they can feed into the council plans and the NHS plans as well. What we're asking is that each of the leads for the different schemes come and present to us and other colleagues across the council and the IBC, and we're just asking them to go through their scheme, what it's achieved, how it's contributed to those core objectives, any challenges and pressures, but also any opportunities for spending it differently, any opportunities to use the money differently next year, which we are receiving those plans at the moment, those future development opportunities. I think it's a really good chance for us to say what's worked really well in the last couple of years and what do we want to do more of in the next years ahead. Vicky will just take us through some of the sort of outcomes or achievements that we've had so far with the funds.
Vicky, could you just introduce yourself? Sorry, you weren't here when we went round the room.
Sorry about that. Yeah, I'm Vicky Dutchburn. I'm the Director of Planning, Operational Delivery and Performance for Kirklees, ICB. So, as Kath says, we're reviewing all the schemes at the present time. I think it's important for us to say that minimal level of investment that we talked about at the beginning, we will maintain, that will be maintained whatever we do with any of the schemes. One of the things that we are doing with the schemes, based on the outcomes that we're looking at and measuring, is trying to ensure that going forward we try and put whole schemes into the BCF pot of money. So I'll use a simple example. On one of those sheets it showed the VCS contribution. That is not the only VCS contribution. It's a specific element against a scheme, but between the two organisations there's a lot more funding goes in to the VCS. So one of the things that we're exploring as we do the deep dives and as we look at the outcomes that we're delivering is actually should we move some schemes in or out of the BCF so that we get a much more holistic picture and a full view of what we're doing. One of the key things, however, within the BCF is we've talked about the discharge funding that's in there as well. And last year, for the first time, one of the things we started having to do was monitor demand and activity against the schemes that we'd included. So one of the things that we did do is we tried to align as much of our home first approach and model into the BCF as we could, so that there was quite a significant movement over the last year of the schemes that were included in there. And that was because we could show and we could start to count and quantify what we were delivering, but also if it was having an impact for the system, as in Kirklees, that we were wanting our home first model to have, but also the total value of that spend. And the total value is greater than what is actually in here. If you look at what we have in the discharge fund, the BCF schemes, the overall social care funding, as well as then what we spend on some of our other discharge pathways and into continuing care, etc. So there's a lot that's trying to keep people at home, out of hospital, or get them back home as quickly as possible. So some of the things that we've done to support us is we commenced a bed modelling process last year, which we now feed in around that activity. So we spent a lot of time trying to understand not only beds, as in, I'm going to say everybody's got a bed in their own house, so we've been counting that. So it's about the packages that we put in to support people, those people that are supported at home, but those people that are also supported through intermediate care pathways, reablement pathways, or even short stay, so that we can quantify, is it a bed that we're paying for, is it a package of care, or could be a mixture of the two. So we've come up with a tool that we have agreed, and we've got that modelling going through now that we use. What we also do is it shows us where that demand shift is now going to and coming from. So we're tying it up much more closely with our discharge pathways, and we talk on one of the other slides about pathways 1 to 3 and 2 to 3. So what we're specifically looking at with our acute trusts is those patients that need to come out of hospital, and what are the needs of those patients, and align it with the indicators that they've got, so that what we can then do is track a patient's, I don't like the word journey, but we always talk about journeys, don't we? But we can track that patient's journey from when they're in hospital and back out. What we also are able to do, though, is also through some of the schemes that we've got, is monitor the avoided admissions. So we've got specific schemes that look at avoided admissions. So they're on our dashboard. And that is, I'm going to say it's relatively new. It's only been in place for the last 12 months. And unfortunately for us last year, NHS England and ADAS kept changing. So every quarter when we were doing the return, they changed the indicators that we had to report against. So we never got what I think me and Kath would say was a good baseline for us to report against. It looks like a similar thing's happening this year, but we have got our dashboard and we are monitoring that. So what's going to start happening now is that through the Health and Care Partnership Board, which is our joint partnership board, through the quarterly performance reports, we're including now a section on the BCF specifically. So the first one, which will be going October, I was going to say this month, but it's October, we'll do a summarised version of the sign-off process, what we've included, and then after that quarterly it'll show the dashboard and the indicators that we've been measuring. As I've said, some of the key elements are around our home first, and myself and Kath are just setting up a process to do a bit of a deep dive into home first further, to look at, is it delivering what we expected it to deliver at this point in the programme, and do some revisions to that. But also to look at, is it that we're not investing enough? And I think we can both sit here and say, we don't think that's the case. We think there is the investment going into those services. It's more probably about aligning the systems and processes across the entire partnership. So it's how we can streamline, get those more efficient. And as I've said before, this isn't about reducing the budget. This is about making sure we're getting value for money and getting the absolute maximum out of that, because we all know new money's very scarce. What it's also doing is our home first is looking specifically at that left shift of work as well. So by being able to evidence with our trusts that we're starting to move out the people who are delayed transfers of care or longer transfers of care, if we can reduce that down, it's about what we can shift to bolster up those pathways going forward. Going further, it will be about our system planning workshops. So we're doing the scheme workshops, but we're also, under our Wells programme, doing system planning workshops. And within that, we'll be factoring in more of the capacity planning. So next year's capacity plan will change because of the modelling that we do. And then I think the final slide is just talking to you about the next steps, which is obviously finalising and signing off our Section 75 agreement, working on the developments from the deep dives that we're doing this year about, is the money in the right place, do we need to move it, tweak it, and then making sure the updates go through the Health and Care Partnership for people to see that progress.
Thank you, Vicky. Anybody have any questions? Rachel?
Thanks for that. Really good to see. I just wondered, I mean, we all know social prescribing is a good thing. And I suppose it would just be interesting to see how that sort of more preventative type activity differs in terms of impact to some of the more closer to the acute side of things. And I guess I'm kind of keen to see how things like our community anchors and community champions can maybe play a part as part of this, because I think that obviously social prescribing's been around a long time and it has a really strong role, but I think we've got some really innovative stuff through the VCSE and Kirklees, and it'd be good to see how that might be helping to contribute to this. I'm sure you'll be considering that as part of your plans for next year, but it would be really good to see that because I think it's quite unique to us.
Yeah, and just on that one, I mean, the social prescribers is different. We have a range of different social prescribers. Some started with the additional funding that went into primary care and has moved into BCF. Other elements, we put the funding specifically into the BCF to do the social prescribing. So it's a bit of a, I'm going to say, hybrid model at the minute. We do know the community champions. We've seen lots of things over the last 12 months about the outputs that we're getting from that, and that being delivered through non-recurrent funding currently. And it is certainly on mine and Kath's radar because it's one of the areas that will be coming into the BCF from next year. So we've already agreed that, and that's partly why we're doing the deep dive, to make sure that we get the funding in the right place to be able to do that. So yeah, it will be coming through.
Anybody else? Thank you, Kath and Vicky. I'd like to ask, because there's going to be so many changes, and you've talked about things moving in and out of the Better Care Fund for good planning, and you talked about how 2 years is great instead of one, but it's still only 2 years, and there's money that is non-recurrent and programmes coming in with that funding and the deep dives, the Home First, etc. I'd like to think that when you've got a better picture of what's coming into the years ahead, where we haven't got a defined funding pot at the moment, when would be, if you can come back to me and let me know when would be a good time for you to come back and give us an overview of how the picture's changed.
Yeah.
And we can add that to our thoughts on the work plan.
Yeah, definitely. I think one of the things for me and Kath as well on this is we've tried really hard where the money has been non-recurrent to try and get that focused on supporting transformational change and pump priming, so that if it isn't recurrent or we don't get another pot, we're not dependent on it, because what it's enabled us to do is change some of the other services and pathways quicker than maybe we could have done before.
And I think we can probably, I mean, we said that we, by end of October, which, like you say, it's next week, October, so, but by the end of October, we'll have had all of the reviews of the current schemes, and we're going to be starting that planning for next year, so we're happy to come back and talk through any of the things that have come up there, and, yeah, any ideas that have arisen.
That's great. Anybody else would like to ask anything to Kath and Vicky? Right, thank you very much for the presentation, and we look forward to hearing how things move forward. That takes us on to agenda item 10, and the pharmaceutical needs assessment update. You've all had the report. Are there any questions from the board? Sorry. Sorry, Owen. Could you introduce yourself, please, and let us know about the update?
Yeah, thank you. Yeah, my name's Owen Richardson, the Data and Insight Enablement Lead for Public Health at Kirklees Council. To be honest, I haven't put a presentation together. I was just going to talk through the paper, but as you say, you've all seen the paper, so I'm happy to take questions, or I could briefly summarise what's in the paper if you prefer.
If you could give us a quick summary, that would be great if anybody hasn't had time to absorb everything in it.
Sure, yeah. Okay, so there were two parts to the briefing paper. The first part was to update the board on pharmacy changes that we've had in Kirklees in roughly the last year, since the last time I came and presented on that. So there was a list of changes, change of ownership, 6 changes of supplementary hours. 5 of them were reductions in hours, and 1 of them was an increase in pharmacy hours. Change of trading name, 2 closures of pharmacies in Kirklees. We regularly meet as a small subgroup to discuss the changes and the impact that they may have on local pharmacy provision. And looking at both those closures, we decided there was going to be no significant impact to the local population. We've had 1 new pharmacy opening, which is a distance selling premises, so no face-to-face interaction. And then 1 pharmacy has moved slightly, so no significant change, relocation. 2 applications were refused, both for distance selling premises. And we've currently got 3 that are pending a decision, so they're currently open to consultation. And you will have had information about that because it gets circulated to the Health and Wellbeing Board during those consultation phases. So that was my update on pharmacy changes. And then secondly, while I'm here, just to inform you of the process and where we're at in that process for the next pharmaceutical needs assessment. Pharmaceutical needs assessments need to be refreshed or rewritten every 3 years, and ours is due to be published again in September, towards the end of September next year, and that'll be the 3 years up for the current P&A. What we did last time around was we convened a West Yorkshire-wide steering group to do our P&As together, collectively together, but to write individual reports. Every Health and Wellbeing Board has to have its own P&A. So we're going to follow the same process again. It just makes it easier for having meetings and avoiding duplication of people attending those meetings, but also we can share some of the workload between us as well. So we've started meeting regularly now as a steering group. I gave some of the kind of key milestones that are coming up. We're going to go out to public and pharmacy survey shortly, so October and November we'll be sending a survey out for people to give their views on current pharmacy provision. And then in February next year, there'll be a draft of the report circulated to the board prior to public consultation. The report has to go out to 60-day public consultation before it's published. So we'll circulate a draft to the board and then public consultation through March and April roughly. And then any amendments, and I'll bring the report back for final sign-off sometime around July, August, September time. And then it will be published in time for the old one running out and the new one beginning. That's it.
That's great, thank you. And does anybody have any questions for?
Thanks, Owen. I feel like I should know the answer to this question, so apologies that I don't. You've talked about the West Yorkshire work. Does somebody look at the 5 individual West Yorkshire pharmaceutical needs assessments from actually people don't necessarily live their lives within local authority boundaries? People who live in Wakefield might go to Kirklees, and people who live in Kirklees might go to Calderdale. And is there that review done as well?
Yeah, and obviously we border non-West Yorkshire local authority areas as well. So yeah, we look at pharmacy provision in the round. We can see where Kirklees residents are accessing some of the pharmacy services. We also look at when we look at like distance to pharmacies and the services that are provided. We look beyond the Kirklees boundary. But we also share within that West Yorkshire group. It is very useful to meet because we kind of share information about things that are happening. And yeah, I know that Wakefield, for example, had quite a few more pharmacy closures than Kirklees had over the last year or so. So yeah, so it's interesting to see it from that view.
Thank you, that's really helpful.
Anyone else? So as board members, we can note that. Everybody happy to note the information in there. So I think that brings the meeting just about to an end. But what I'd like you to be thinking about before the next meeting is we have a development meeting in November, and we need to look at really making a good work plan. So in the meantime, if you can send through any ideas you have that you'd like to see on the work plan. Personally, one of the things that Owen's mentioned is the distance selling. So we're always looking at the pharmaceutical needs assessment. This is a relatively new market for most of us. We normally go to the chemist. I would be interested in hearing of how the online pharmaceutical network is coming together and how people are accessing it and what that means for people who aren't digitally savvy and the same. That's something I'd be interested in, plus the things that we've looked at today. So please do send through so we've got a good pot of things to go at, and we can perhaps bring information with us to November rather than saying it in November, putting it on a plan and having to go away. We can have a look. Some things might be resolved, but other things might be, you know, that bit further ahead. We can really get to the meat of what we want to know. Anybody's got any other questions? Right, thank you very much for your attendance and for your patience in my first chairing.